group project is on Vietnam. Vietnam is located in the East Asia and Pacific region with a total area of 3,031,210 square kilometers. And they have a population of 95,540,395 people. And Vietnam belongs to a lower middle income group.
So getting into the global burden of disease in Vietnam, before diving straight in, just going to reinstate a definition of burden of disease. Global burden of disease is essentially the most comprehensive effort to date to measure epidemiological topics worldwide. As you can see in the chart below, we have three main categories that we're going to be concentrated within the BODs. So we have communicable diseases, non-communicable, and injuries. As of Vietnam as a whole, Vietnam has a total DALYs of all forms of causes, a total number of 25,192.8. And just looking at the chart below, we can see as of most recent studies, we see in 2016 non-communicable seems to be the most prevalent. Funny enough, it actually the DALYs in that category, non-communicable, actually rose since 2000. This really brings up the topic of, what are the health public officials doing? How are the health initiatives going on within the country? What can we do to prevent more uprising in the DALYs?
When considering health status in Vietnam, we must examine what is causing deaths within the population. People of all ages are dying from strokes, isotonic heart disease, and lung cancer. People under 5 are dying from neonatal disorder, congenital birth defects, and lower respiratory infections. And adults aged 15 to 45 are dying from road accidents, HIV/AIDS, and strokes. This data proves that we must focus on how different age groups and age ranges are suffering from different diseases and not just focus on DALYs lost and non-communicable diseases.
We recommend three main public health issues. Number 1, cardiovascular disease. Number 2, lung cancer. Number 3, road injuries. Number 1, we recommend cardiovascular disease due to its high prevalence in all ages of death. Number 2, lung cancer is number 3 for all causes of all deaths. Number 3, road injuries. We have chose this due to it being number 1 cause of death for all ages of 15 to 49.
So risk factors are variables that depicts the risk level or susceptibility to diseases, cancers, injuries, and even death. In this report, risk factors will be calculated with the measurement of DALYs. And these risk factors are elements that can include human behaviors, tendencies, cultural influences, environmental influences, as well as governmental and economic impact. And as you can see below, there is a chart regarding the three public health issues we addressed earlier. So the first one, we have cardiovascular diseases. One of the more prevalent issues and risk factors involved in this is unhealthy diets. We have other things such as smoking, physical inactivity, and harmful use of alcohol. Moving forwards, we have lung cancer. Lung cancer, we have prevalence in the risk factors of, behavioral risks, environmental and occupational risk, and including air pollution. And last but not least, we have road injuries. We found that big risk factors due to this was due to behavioral risks, alcohol and drugs, environmental and occupational risks.
After investigating into health issues and risk factors involved with diseases in Vietnam, we came up with interventions and recommendations to help solve public health issues. Recommendations will revolve around prevention and changing many of the lifestyle and unhealthy living conditions within Vietnam. Education will be the first priority in our recommendations, implementing programs and support systems within primary and secondary education aimed at prevention. These will target the youth to educate them on risky behaviors and how smoking and alcohol consumption is bad for their health and will lead to further health problems in the future. Additionally, we will also target not only the youth, but targeting the older demographic people to educate them on secondhand smoking to reduce exposure of young people to secondhand smokes and smoke within households. This will help reduce cardiovascular disease and lung cancers as people will be less willing to participate in risky behaviors and unhealthy lifestyles through the consumption of alcohol and smoking and poor diet.
Social marketing. Social marketing is a well-used method to advertise the benefits of certain actions and damaging results of others. These methods include social media marketing and sustainable marketing.
In Vietnam, people can easily buy the cigarettes in the restaurant or the store. The government should enact corresponding laws to restrict teenager smoking. If teenagers are found buying cigarettes in shops, they could be fined and recorded to avoid their next offense. If a teenager who's under 18 can easily buy cigarettes with increase the risk of high blood pressure, heart disease, and lung cancer. Next, the government can encourage people to buy electric car instead of normal cars, which can highly reduce the pollution caused by vehicle emissions. People who drive the car after drinking alcohol should be punished, maybe go to the jail. Limited this irresponsible behavior can reduce the injuries on the road.